Welcome. This is dual option for getting the disclosures and treatment information as you come to therapy with me, Dr. Julia Bernards. So today we are going to go over a number of things. Start with just a welcome and let you know the image there is my office. This is what you can expect as you come in. And it's a bigger office. I work with couples and families a fair amount, and sometimes we just need space. About me. So, I have been married for 25 years, got 4 kids, 3 grown and moved out. My youngest is in high school. I, as a therapist, am really passionate about my work. My goal is to collaborate with you to achieve your mental health and relational goals and to help you feel like you are able to be your best self. I believe as I'm approaching people in therapy that everyone is behaving the way that they are for a good reason, and that just because it's a good reason doesn't mean it doesn't have something to do with the problem that you're bringing in. In relational therapy, I don't take sides. Relational therapy is like couples or family work. In family therapy, I do consider parents primarily responsible for making changes. But I'm also going to work with kids, with everyone to help everyone be their best self. In couples therapy, I work with each partner to recognize their part in the presenting issues and to make changes that are within their control. In individual therapy, I focus on helping clients understand what is going on within them without shaming any part of them and empowering them to make healthy internal and external changes. My philosophy in therapy is humanistic, experiential, attachment-based, and systemic. And I'll explain what each of those means. Humanistic basically means that I assume the best of people. And as we are working together, I help you have self-compassion as we seek to understand and change thoughts, behaviors, emotions that are negatively impacting you and your relationships. Experiential, that means that one of the things I believe about making changes is that experiencing new things and having new perspectives because of those new experiences is essential. So in addition to talking in therapy, we will be doing exercises that are designed to help you experience things differently. Attachment-based means, I believe, having safe, secure relationships with other people who are physically and emotionally accessible, responsive, engaged with you is essential to your well-being, and so that will be a focus in therapy. I consider the ways that lots of different factors play into what we are dealing with in therapy, and that's part of that systemic focus. So whether I'm doing individual, couple, or family therapy, we are considering also the contexts that apply in the situation that you want to change. All right, what to expect in therapy. Here's another view of that room. You can expect to see this room and all those things in it. Therapy is going to begin with assessment. Even before you walk into the room, you will have filled out a couple of assessments. And that will help me as we review the issues that brought you in, help me understand the symptoms you're experiencing. And then also as part of that assessment, we'll go over your personal and relational history, interaction patterns that you're noticing, and we'll talk about your goals. Assessments will continue through the course of therapy. That might be self-report questionnaires. It might be assessing through conversation. I do some sculpting exercises. Sometimes I use sand tray, all of those to help me assess and understand what's going on. Also, I'll say this again in another section, but if you are planning to use insurance for our therapy, We have to determine if there is an appropriate mental health diagnosis because insurance won't pay if there's not a mental health diagnosis. So doing the assessments early on helps us determine that. Another important reason to be doing assessment is that it helps me get a sense of where we are. Your goals then will help me understand where we're going. So getting from where we are and being able to conceptualize that to where we're going, which is the goal, is the work of therapy. And you can expect therapy to be mental and emotional work, both in session and at home. I usually give homework, and that work is something just like if you are doing physical therapy or going to the gym, you can expect to need to do work in order to make changes. How frequently you come, that's another part of therapy. That will depend on the level of distress that you're experiencing, as well as your schedule and my schedule. I'll talk more about scheduling later, but I do suggest you schedule multiple sessions in advance. If your level of distress is greater than can be addressed in weekly outpatient therapy, which is what I provide, then I will recommend a higher level of care. For example, intensive outpatient or a partial hospitalization program. Or in some cases, someone might need inpatient care. I will also recommend that you talk to a clinician who can prescribe and manage medication if that seems to be something that you would benefit from. I do not prescribe medication. In relational therapy, again, that's therapy with couples or families. Interventions are typically aimed at addressing and improving relational dynamics, communication patterns, and interactions that impact your mental health. In relational therapy, I like to see the whole system, meaning the couple or the family, all together in the first appointment, and then to spend time with individuals or subgroups through the course of therapy. In relational therapy, I don't keep secrets, meaning if someone tells me something when I'm meeting with them individually, that would be destructive to the relationship and something that is materially impactful to the other person, then I will coordinate with the person who disclosed that to let the other person know as soon as possible. One of the reasons for that is it is important for me to be able to have a safe relationship with all of the people in therapy. And if I'm keeping a secret from someone, that's not safe for them. In couples therapy, if one or both partners are leaning out of the relationship, meaning you're considering ending the relationship rather than working on it, we will do something called discernment counseling rather than couples therapy. And before deciding which of those, I will probably do some additional assessment. If you know that one of you is considering not staying in the relationship, it would be helpful for me to know that at the very beginning of therapy. You can indicate that in your paperwork or in the beginning of the first session. If I am seeing you for relational therapy, I recommend getting a different therapist for any individual therapy you do. I'm happy to coordinate care with your other therapist or medical providers. Conversely, if I'm seeing you for individual therapy, I recommend getting a different therapist for any relational therapy you do. I'm happy to coordinate care, again, with any other therapists. So, therapeutic outcomes and client responsibilities. For me, success in therapy means we achieve your goals. We decrease the distress you're experiencing, and you don't need to come to therapy anymore. That's my goal in therapy, is for people to no longer need therapy. The models that I use in therapy are evidence-based. That means there has been research that indicates they work, and I've found them to be effective. I take therapy seriously and actively work to bring my best self to each session so that I am present and engaged in our work together. You have a very important role in how therapy goes also, and whether it's successful. Three important factors that are key to the outcome of therapy are: one, our relationship; 2, your expectations about therapy, and 3, your participation in therapy. So let me break that down. Our relationship means whether you feel safe and comfortable with me and like I understand where you're coming from, whether you feel like we are on the same page about your goals, and whether you feel good about what we are doing to reach your goals. Your expectations about therapy are particularly, in this case, whether you believe it will be helpful and are hopeful about the process. Sometimes people feel forced into therapy. They don't think it will work. They resent being there. That is less likely to be a situation in which there will be a successful outcome. Then third, your participation in therapy. And that includes putting in the effort instead of checking out or withholding information, and also doing any homework. If therapy, this is your rights and responsibilities, if therapy is not going well for you, it is your right and responsibility to say so. Sharing your concerns, whether that means you're not feeling comfortable or safe, you're not feeling like I'm getting something, like we're not on the same page, or you're not feeling good about what we are doing, how we're trying to get to the goals, or anything else. That can be hard to do, to share those things, but if you don't share, then it is going to make having success in therapy a lot harder. I always appreciate hearing from clients about what is or is not working for them. Everybody is different, just like different medications work differently for different people, different interventions and styles work differently, and some are better and worse for different people. So you coming back and saying, this isn't working for me, is not a problem. It gives me valuable information. Also, if I have concerns, I will bring them up. I'm happy to work with you to address concerns, or if that's appropriate, we can help you find a different therapist. If there is a pressing concern or serious distress or new symptoms are coming up that have come up since we last met or that happened in the last session, please bring those up at the beginning of session so that we can deal with them. Next, confidentiality in therapy is a fundamental principle. It ensures your privacy and safety, and it fosters trust in our relationship. I'm legally and ethically bound to keep any identifying information confidential, except in specific circumstances where disclosure is required by law. And that would be if I hear from someone that a child or a vulnerable adult, that means an adult who can't take care of themselves, is being harmed or is in danger, or if someone intends to harm themselves or someone else, then I report to someone who could keep that person safe. To maintain your confidentiality, if I happen to run into you in public, I will not greet you or acknowledge that I know you. You're welcome to greet me if you want to, but feel no obligation to do so. Also, in social media, I do not friend or follow clients. Participants in relational therapy, so a family or couples case, I assume that both people who are coming have a right to know about appointments that they are expected to be part of. So if you are coming in, for example, for couples therapy, and then you guys decide to split up, you need to let me and the office know that you do not want any confidential information, including about appointments that you may or may not have, to be shared with the other person. Parents of minors have a right to know about their children's sessions, and I will be judicious in what I share. Having a trusting relationship with every client is essential, and it can be hard, especially for teens, to feel safe sharing what they need and want to share if they expect that I will tell their parents every word that comes out of their mouth. So I request for parents to respect teens' privacy and understand that if I do have serious concerns, I will let the parent know. Also, I want to involve parents in minors therapy. That's a priority for me. If something is going on with a kid, I think that probably the parent is going to be in one of the best situations to address that. And so I will want to keep you in the loop. Last, communication methods. Information about your appointments will be texted or emailed to you. Communication from me might come through text or email with your permission. I can't ensure the privacy of emails and texts, obviously. So if you don't want communication to come that way, please let me and the front office know. There is a confidential patient portal that we can send information through. You would still get an email that you have a message usually, but you can check that, and it'll be password protected. All right, fees and insurance. My current self-pay rates, this is August 2024, are $125 for an individual session, $150 for a relational session. Sessions are typically 45 to 50 minutes. If we determine that a longer session would be valuable, every additional 30 minutes or fraction thereof will be another $65 for individual sessions and $75 for relational sessions. If you would like insurance to pay for individual, couple, or family therapy, we have to be treating a diagnosed mental health condition. Again, as I mentioned at the beginning with assessments, intake forms and those first session assessments will determine if there is an appropriate diagnosis. It will also be helpful to know if there have been any previous mental health diagnoses, and diagnoses do go on your medical record. If insurance pays for your therapy, meaning we have a mental health diagnosis, then Lifescapes Counseling will bill your insurance on your behalf, and we will accept that contracted rate. You are responsible for copays and deductible. If I don't take your insurance, you can self-pay, and Lifescapes may provide a super bill for you to submit to your insurance if you want. I don't take Medicare. Medicare recently required that licensed marriage and family therapists who do not take Medicare let Medicare patients know that we will not submit bills to Medicare, and also that patients cannot submit bills for my services to Medicare. By agreeing to see me, you are also agreeing to self-pay for the services and not to submit bills for services that I provide to Medicare. Regardless of whether you choose to use insurance or self-pay options, it's important to understand your financial responsibilities and be able to communicate clearly with our client or billing coordinator about your preferences. Before beginning therapy, they will work with you to determine whatever is the most suitable payment option. Scheduling and cancellations. You will schedule all of our appointments through the office staff. You can see in this picture here, this is our front office. When you walk into our offices, you will come up there to check in. You can also schedule there. You'll pay whatever you're paying for that visit that day right there. So having you schedule through them allows us not to take time during our appointment to schedule. You can schedule up to 4 sessions with me in advance. Once one of those is complete, you can schedule another. So if you have 4 sessions on the books, then when you come in for a session, you can go up to the front desk at the end and schedule your next one. If you are unable to schedule for a time or with the frequency that you want, you can request to be put on my cancellation list. That means if somebody is not able to come in at their scheduled time, you could get a call, and if that appointment time works for you, you can take it. If you need to cancel any appointments, please give us as much advance notice as possible. That allows someone else to have that appointment time. Also, for any cancellations that happen with less than 24 hours of notice, you will be charged $60. I can make exceptions if there's like a sudden illness or a family emergency. But again, I just ask that you let us know as soon as possible if you know you will not be able to attend an appointment. Sometimes I will need to cancel an appointment, or I will block off days that I usually work I try to give the office staff at least a month of notice. Sometimes they will not communicate that I'm not able to come in at a certain time. For like if you have something that is has been a recurring appointment, and you expect to be coming in that time because that's, when you're 4 sessions, you keep scheduling at the same time, they might not give you the whole month of advance notice, and that's just because they don't want to confuse you about when the appointment is not going to happen, and so they'll probably give you 1 to 2 weeks of notice. But you're always welcome to check in and see if there are any upcoming appointments that you have that need to be rescheduled. All right, that's the end. If you have any questions, you can contact the office or ask me when we meet in person. I'll look forward to meeting with you.